Welcome to this explainer. Today, we're uncovering why veterinarians might just be the absolute most underrated medical professionals on the planet. I mean, if you've ever thought of a vet as simply someone who gives your puppy a quick checkup, well, prepare to have your perspective completely flipped. We're going to dive deep into the hidden systems, the global health networks, and the incredible science that these professionals manage every single day. Just picture a doctor who is a master of surgery, nutrition, pharmacology, and public health, all while treating not just one, but literally hundreds of entirely different species. It really begs the question, who is the most important doctor you've never visited? The wild truth is, most of us only think of them when our dog or cat gets sick. We totally overlook the massive, foundational role they play in our own lives, right behind the scenes. All right, Section 1. More than pet doctors. Breaking the cats and dogs myth. Let's go ahead and shatter that common misconception that veterinarians are just hanging out treating pets in a local clinic. Veterinary medicine actually covers an insanely broad range of disciplines. We're talking about livestock and wildlife health, where they manage entire herds and complex ecosystems. Then there's disease research and biomedical sciences. That's actually deeply involved in the foundational research that advances all medical science. They also handle public health and zoonotic disease prevention, which is a massive deal we'll unpack in a minute. Add to that a deep understanding of nutrition science and the mind-boggling task of mastering pharmacology across multiple species. Just think about that for a second. A human doctor learns how a drug affects one species, humans. A vet? They have to know how that exact same drug behaves in a mammal, a bird, a reptile, you name it. It is a staggering amount of knowledge. Moving right along to Section 2, vets versus doctors. A surprising comparison. Let's see how human medicine and veterinary medicine actually match up. It's fascinating when you compare their foundational approaches. With conventionally trained human doctors, nutrition is often overlooked as a primary focus. It kind of becomes an afterthought. But veterinarians, they consistently investigate diet and nutrition as a root cause of disease. So the crucial takeaway here is that while human medicine can sometimes get hyper-focused on treating symptoms with medication, vets actively use a patient's diet as a fundamental diagnostic tool and a primary line of defense. They're constantly asking, what is the actual root cause here? And it gets wilder, because they have to do all of this for patients who literally cannot speak. Diagnosing a patient without any verbal history relies on pure, raw clinical skill. A human doctor can ask you where it hurts or how long it's been bothering you. A vet gets absolutely zero verbal complaints and no medical history from the patient itself. They have to observe, feel, listen, and figure out the whole puzzle entirely from physical evidence and intuition. But hey, there is one undeniable upside to treating non-human patients. As the old quote goes, one good thing about veterinarian doctors, their patients can't Google their symptoms. It's a funny joke, sure, but it hits the nail on the head. Vets have to rely on objective science, comprehensive lab work, and pure observation rather than trying to untangle some frantic internet self-diagnosis. Okay, Section 3, Heroes of Public Health, the front line of pandemic prevention. This is where the stakes dramatically scale up from the local exam room to global public health. Get a load of this statistic. A massive 60% of infectious human diseases actually originate from animals, while only 40% come from other sources. Let that sink in. The vast majority of infectious threats to humans start out in the animal kingdom. That totally changes how we should view the veterinary profession, doesn't it? Because of this massive crossover threat, vets are absolutely our unsung heroes. They're constantly monitoring zoonotic diseases. Those are the diseases that jump directly from animals to humans. We're talking about incredibly dangerous pathogens like rabies, brucellosis, and bird flu. But it doesn't stop there. Vets are the folks on the ground ensuring food safety in our meat, dairy, and eggs. They're out there tracking antibiotic resistance, which is arguably one of the greatest threats to modern medicine right now. Plus, they actively monitor environmental and ecosystem health. They are basically the early warning radar system for global health threats. And the chilling reality is this. Without veterinarians, the next pandemic could easily go completely undetected. They are literally on the front line. Without their watchful eyes in agricultural hubs, wild environments, and disease research labs, the next major human pandemic could just slip right by unnoticed until it's way too late. They are the initial barrier protecting humanity. So, Section 4, the One Health Framework, ethics, trust, and our interconnected world. Navigating all these global threats requires some incredible responsibility. Every single day, veterinary professionals are executing this complex balancing act that most of us never even consider. Step 1, they must ensure animal welfare.
That's their direct patient, obviously. But step 2, they have to maintain owner trust, which means communicating really complex medical realities to human clients. And finally, step 3, they must protect public safety. Every decision they make, whether it's treating a house cat or a massive herd of cattle, requires balancing the animal's welfare, the owner's trust, and the safety of the broader public.
This entire balancing act is governed by a brilliant overarching framework known as One Health. One Health recognizes that human, animal, and environmental health are deeply and inextricably connected. You simply can't separate human well-being from the health of the animals and ecosystems around us. By treating animals and monitoring the environment, veterinarians are fundamentally practicing human medicine too.
Ultimately, human medicine could learn a ton from this approach. We see the absolute necessity of focusing on preventive care and nutrition as the bedrock of health. We see the huge value in building cross-species medical knowledge to understand biology as a whole. And most importantly, we learn the value of applying holistic, whole-body thinking to medicine, instead of just playing whack-a-mole with isolated symptoms. So the next time you hear the word vet, don't just picture a pet clinic. Think about global food safety. Think about ecosystem management. And ask yourself this final provocative question. Without vets, who spots the next pandemic? Think about the doctor who silently protects your health every single day. I really hope this explainer changed the way you see veterinary medicine. Keep questioning, keep learning, and we'll catch you in the next one.